If you have the symptoms of stroke, get yourself to any hospital, whether it's a private hospital, government hospital, or even a university hospital. There are very clear guidelines set at the level of the emergency department. One of the first things that will happen is an assessment by a neurologist or an emergency physician to confirm that you actually have stroke. And soon after that, an IV line will be started. Certain medications will be given to you to reverse the effect of stroke. So these are typically antiplatelet drugs. Your blood pressure will generally be high if you have a stroke, so medications will be given to control your blood pressure. And immediately after that, an MRI scan will be done urgently to confirm whether you have a stroke, how big is the stroke, where is the stroke, which vessels are involved in the stroke. And based on that, certain treatments will be instituted, one of the most common being thrombolysis, where you run a high-dose IV medication to break off the blood clots. Another option is to actually endovascularly put in a small catheter from your groin going right up to your brain to fish out the clots, to reopen the blood vessels so that you get a resumption of flow to the part of the brain which is affected. In certain situations where the stroke is actually hemorrhagic or where there's a large blood clot involved with the stroke, then you may have to undergo brain surgery to remove the blood clot if it's deemed necessary. The outcome of stroke really depends on how fast you identify the stroke and how fast you get treated.